Hi, my name is Andre Berkin. I'm a registered nurse. I work as a certified specialist in poison information at the Blue Ridge Poison Center. What we do there at the Poison Center is we get calls from and give advice to people about poisoning emergencies. We get calls from all over central and western Virginia, from doctors, nurses in emergency departments and ICUs. We get calls from mothers and fathers at home. We get calls from police, pharmacists, school nurses, and we give them advice about what to do when a poisoning emergency happens. I should give you our phone number. It's 1-800-222-1222. That works anywhere in the country. Okay, I'm going to give you some information. This is a presentation that I did recently about various topics in poisoning, and they all start with a B, so I just called it the B list. The first thing we'll talk about is some B vitamins of toxicological interest and utility. So we're going to be speaking about them. The B vitamins are over-the-counter vitamins that many people are familiar with. They have numbers which don't really mean anything, but the ones that we'll talk to you about are thiamine, niacin, pyridoxine, folate, and cobalamin, and they're just in the order of the numbers that they're given. All of the B complex vitamins are water-soluble, and what they are is food-derived cofactors and coenzymes that are useful in metabolic processes. The B vitamins are not stored in the body because they're water-soluble. The fat-soluble vitamins can be stored in the liver, but we won't talk about them at this point. As I mentioned, they're coenzymes, and it turns out in a lot of toxicological topics, the metabolism of the particular xenobiotics is something that's very important, and so it is with things like ethylene glycol, which, along with another toxic alcohol, methanol, aren't so much toxic in their ingested state, but it's what the body does when those are metabolized that they turn into acidic products, which are the actual toxic factor. In the case of ethylene glycol, it is metabolized by the same enzyme, alcohol dehydrogenase, that regular ethanol is metabolized into glycoaldehyde, glyoxylic, and oxalic acids. And so the B vitamin thiamine is useful in moving that metabolic pathway along and going to metabolize those into products that are less toxic to the body. So sometimes we will recommend giving thiamine to patients who have been poisoned with ethylene glycol. The next B vitamin about which we'll talk is niacin, or nicotinic acid, and this is useful for vapor poisoning, which is vapor is a rodenticide that antagonizes the nicotinamide, and so we'll sometimes recommend that. The other interesting thing about niacin is that some people will take that as a method to fool a drug test. It's also prescribed as a treatment for elevated cholesterol, and even some people who are taking the niacin in normal doses find that they get the flushing. But a lot of times at the Poison Center, if we find that some person has overdosed on niacin, it's in order to try to fool a drug test. The next B vitamin about which we'll speak is pyridoxine or pyridoxamine, and that is B6, and it's a coenzyme in many metabolic reactions. The main thing for which we will recommend that is for isoniazide poisoning. Isoniazide, or INH as it's abbreviated, is a treatment for tuberculosis. But one problem that it has is that it can inhibit the GABA. The GABA, or gamma aminobutyric acid, is an amino acid that occurs in your body. It's an inhibitory neurotransmitter. And if you have an overdose of isoniazide or monomethyl hydrazine, which is a rocket fuel, or even gyrometra mushrooms, you can deplete your GABA, and that will cause some seizures, as the GABA is the inhibitory neurotransmitter. And so if you have a patient who comes in and has seizures and you give them lots of benzodiazepines and find that the seizures are not abating, it might be because the GABA is missing. And as you know, the benzodiazepines are a GABAergic type medicine, but if there's no GABA there, then you have to rethink how you're going to stop these seizures. And the way to do it is to give the person pyridoxine or B6 vitamin, and that will help them restore their GABA and stop the seizures. The next B vitamin about which we'll talk is B9 or folate. You're probably aware that a lot of pregnant women are given folic acid. It's needed for protein synthesis and other important bodily functions. Toxic alcohol for which we often will recommend that is methanol, which is another alcohol which is not so much toxic itself, but it's what the body does to the methanol. Specifically, it starts metabolizing it down a pathway that ends up with formic acid, and so the person can get very metabolically acidic, and therefore it can attack the person's optic nerve and cause an acidosis, which can be quite profound. The folate can help move that pathway along to form regular non-toxic metabolites like carbon dioxide and water. And another B vitamin about which we'll speak is B12, cyanocobalamin, or the hydroxycobalamin is the one that we'll sometimes give, and that can chelate cyanide out of a person's body. What does chelation mean? Most of the time when we talk about it, people think about heavy metals. Chelating is to grab or bind that chemical, and the hydroxycobalamin grabs or binds the cyanide and can allow the person to excrete that renally and therefore get the cyanide out of their system. And the last B vitamin about which we'll talk is L-carnitine, which is also an endogenous carboxylic acid, and this is useful in the metabolism of valproic acid, which is a commonly used anti-epileptic. And with an overdose of valproic acid, you can get a hyperammonemia, and the L-carnitine prevents and treats the hyperammonemia that is associated with valproic acid overdose. The next category of toxins that we're going to talk about is beta blockers. Many people are familiar with beta blockers. They're very useful in managing abnormal heart rhythms, and in a person who's had a myocardial infarction, it can reduce the chances of that person having a second or third, and also treats hypertension. And the way they work is they block the receptors for the endogenous catecholamines epinephrine and norepinephrine. But as you know, in overdose, you can have a bradycardia, you can have heart block, you can have hypotension, and interestingly enough, you can actually have a hypoglycemia as well. The beta blockers block the beta-2 adrenoreceptors, which blocks the stimulation of the glycogenolysis in the liver and the stimulation of pancreatic release in the glucagon. And another cardioactive substance, which is sometimes found in overdose when we get a call, is calcium channel blockers. And sometimes it's difficult to tell which of these toxins has been taken in overdose between the beta blockers and the calcium channel blockers. And so one clue that we sometimes use is the looking at the glucose, and the beta blockers typically cause a hypoglycemia, and the calcium channel blockers frequently cause a hyperglycemia. And my mnemonic for that is that the B low, or the beta blockers, cause a lower glucose, and Ca++, which is the calcium cation, cause a hyperglycemia. Treatment for beta blockers, um, obviously intravenous fluids if the person's hypotensive. Sometimes atropine can be given for the bradycardia, although that's not a directly effective way of increasing the heart rate in a lot of cases. Glucagon is often given, which gets more glucose out there. That can increase the strength of the cardiac contraction and decrease the vascular resistance. Vasopressors useful are norepinephrine, epinephrine, and dopamine. And as mentioned here, some of the non-pharmacological treatments, a balloon pump and things like that. Very often the best way to treat the beta blocker overdoses is with high-dose insulin and euglycemia, where we give a really, really large amount of insulin and give enough glucose so that the person doesn't become hypoglycemic, and monitoring the glucose level, of course, and monitoring the vital signs. A lot of times you have to call up the pharmacist and tell them, yes, we really want to give the person 100 units of insulin. That'll cover beta blockers for now. Other chemicals that we sometimes get calls about are those who are cholinergic agents, specifically muscarinic agents. The cholinergics are, of course, divided into the muscarinic and the nicotinic. And there's a saying about the killer bees when one has a cholinesterase inhibitor. The main ones that we might find are organophosphate and carbamate insecticides. And of course, on the really scary ones are the warfare agents, sarin and VX, called nerve agents. And also some muscarinic mushrooms are cholinesterase inhibitors. The mnemonic that we use for the muscarinic portion of the cholinergic syndrome or toxidrome is dumbbells. You may have heard of that. When you have too much of the cholinergic effect, you can have diarrhea, urination, meiosis, bronchospasm, bronchorrhea, and bradycardia. You can have emesis, lacrimation, and salivation, secretion, and sweating. As you can see, all of those things are going to eventually cause your dehydration, but it's the ones, the killer bees, the bronchospasm, where your airway closes up, the bronchorrhea, where you get too much fluid in your bronchi, or the bradycardia. Those are the things that will kill you right there, and so we call those the killer bees. Treatment for those are atropine, which is anticholinergic, antimuscarinic, and sometimes you need quite a bit of that, and the end point of administering that would be the drying up of the secretions that otherwise would be flooding the person's lungs, and also often pralidoxime, an oxime that helps in treating that. The final category of bees that we're going to talk about is the honeybees or other bees. The order is Hymenoptera, family Apidae. The bee venom is a mixture of enzymes that are very irritating in the skin. The honeybees leave their stinger in the wound, so they die when they leave, but the stinging insects, the Vespidae, the wasps, hornets, and yellow jackets, those stingers remain intact, and so the wasp can fly around and sting you again. The symptoms, of course, everyone's familiar with: pain, inflammatory reactions, itching. You can also have allergic reactions, which are the things that can be life-threatening, where you have hypotension, urticaria, angioedema, shock. Treatment for those anaphylactic reactions, of course, epinephrine. You can use an EpiPen. Many people who are allergic to bees are carrying EpiPens in order to treat themselves in the moment. Antihistamines that are effective, of course, are diphenhydramine or hydroxyzine, or H2 blockers such as ranitidine. If necessary, the person will go to the emergency department, get some intravenous fluids. Ice sometimes helps, papain, which can help, or corticosteroids, will reduce the inflammatory response that can be otherwise even life-threatening. Thank you very much for listening, and call the Poison Center if you have any questions.